to present one case to you. It's just to think about immunotherapy and just think outside the box like Dr. Hussein Haftawi does. So this is the question really, is allergen immunotherapy science or quackery? And I think there's no doubt that it's really science behind immunotherapy. So again, allergen immunotherapy, I think Dr. Zaytoun has gone through the definitions of it, but the most important thing that I want to emphasize is that it has to be IgA-mediated disease. It has to be, you have to find evidence of IgA-mediated disease in these patients before considering allergen immunotherapy. Allergen tests that are not proven to be credible include this list. I mean, this is just a list of unproven tests for allergy, and quacks are using all of these, not only here but also in Europe and North America, I'm sure. And of course, any test that is positive on these panel of testing isn't an indication for allergen immunotherapy. I mean, one of the things that we use a lot, or we see a lot in this region, is IgA antibodies, and of course, this is, in my view, is a lot of rubbish, to be honest with you. I think we're for the moment, anyway, there's no supporting evidence that IgE really is involved in mediating true allergies. And again, I don't want to repeat myself here or repeat what others have said. I mean, allergen immunotherapy is really important part of looking after patients with allergic rhinitis. It is from the ARIA guidelines since 2001, and it is really indicated for people with moderate to severe disease, and it has to be introduced maybe later when everything fails. It is science, there's no doubt about it, because it induces immunological tolerance to specific allergen. And again, it's important to know that really allergen immunotherapy is a specific treatment. So it does not interfere with, if you have an allergy to grass, if you have a patient with house dust mite, if you give house dust mite is specific for that. There is some evidence that it may cause a bystander effect, but the evidence is very little. And the mechanism, as Professor Westenberg said, we don't really know how does it work, but I think IgG4, when induced by allergen immunotherapy, it mops up the allergen, and that's actually, so the allergen becomes less available to trigger mast cells, and that's how the effect is induced. Although TGF-beta is an important cytokine, if you like, in allergen immunotherapy, and that is, it has an anti-inflammatory effect, and it has an immunosuppressive effect as well, and so it is really important in inducing tolerance to allergens. And of course, it is science because it modifies the course of disease. It avoids, there's evidence, some strong evidence that it avoids disease progression and prevents allergic symptoms, and possibly it offers a cure of the disease. And we've seen it in patients with monosynthesized, like Dr. Shaib said, that it actually, I mean, I had patients where their symptoms are actually gone. So it is the only way of teaching the immune system to tolerate allergic triggers and offers a possible cure to the allergic symptoms. And again, I'm not going to go through this, in detail. So IgE-mediated disease is really the key message here. Clinical features and positive testing. Of course, inability to avoid allergens, poor response to drug treatment. And again, we need to put patients in the picture. Sometimes patients look. I mean, I had a patient yesterday who said, "Look, doctor, I'm fed up of using lots of, nasal drops, tablets, etc. Is there anything else in the box?" So I said, "Yeah, allergen immunotherapy." And luckily he's monosynthesized, so I'm expecting that he will respond. To me, there is no contraindication. All the contraindications are relative. Uncontrolled asthma. Now, most of asthmatic patients are really relatively controlled. I haven't seen the patients with status asthmaticus since I moved here. Beta blockers, immunodeficiency sources, I've used them in all of these groups. Of course, in pregnancy, I try not to initiate it, but patients or ladies who are pregnant, we can continue maintenance therapy, either SLIT or SCIT. So there are no absolute contraindications. All the contraindications are relevant in my mind. And again, there are two types. There are subcutaneous and sublingual. And the subcutaneous, it's very effective in wasp and bee venom allergy. Unfortunately, and allergy. And unfortunately, we don't have SCIT or subcutaneous immunotherapy for insects here. And it's very effective in allergic rhinitis and asthma. The problem with it is that there are safety concerns, and of course, inconvenience because the patient has to come to the hospital, etc., etc. Sublingual is very attractive for many patients because, patient can do it at home, either through drops or tablets, commonly used in Europe mostly. Now in the States and North America is less probably used. And it's popular, the vaccine is kept under the tongue for 1 or 2 minutes and then swallowed. There are drops, sprays, tablets, etc. Grazax is one of the initial products that have been introduced in a tablet form. In the past, a lot of these products have been used as drops. Grazax is a tablet form used for grass allergy, and it is fast dissolving sublingual tablets, contains grass pollen, particularly Timothy grass. And of course, it's used for 3 years. The indications allergic rhinitis and conjunctivitis. I don't tend to use the commercial name, but there's no other name for Grazax except Grazax, of course. And the reason I'm mentioning Grazax is that because I've treated the patients a while back. He's an Irish young lad, 24-year-old. Then when I saw him, this guy had severe hay fever for 11 years. This guy used to keep himself indoors from May to maybe September, October, indoors. Basically, his mother, he lives alone. His mother does the shopping for him. And he had poor response to all symptomatic treatment. Of course, he tested significantly positive or strongly positive for grass pollen. And he was commenced on Grazax, excellent control of his symptoms, significant improvement. He completed the 3-year treatment, and he was picked up by the tabloid papers in Ireland. And this is his stories. He was photographed on a grass. Ireland is a very green country, and he was photographed smiling there. And you can see the capture there. And here is the pill that finally put sufferers out of their misery. And he's kept doing very well, actually. So thank you. That's my case, and I'm happy to take any questions. And this is just to give you another perspective of how immunotherapy really works.